Good afternoon. I want to welcome our witnesses for today's Personnel Subcommittee hearing, and I want to offer a very special thank you to Ranking Member Scott for helping on this committee and doing it on rather short notice, and also for our other members for joining us as we examine opportunities to save money at the Pentagon. Members of Congress, and this committee in particular, have a responsibility to root out waste and price gouging in Pentagon spending. We owe it to the men and women of the military who rely on us to fund the equipment activities they need to defend us, and we owe it to the taxpayers who foot the bill. I don't think it will be a surprise to anybody when I tell you we have a lot of work to do on this front. This year, the Department of Defense requested $842 billion in funding. And just last month, negotiators had barely agreed as part of a bipartisan deal to lift the nation and avoid default on the nation's debt to limit this year's department funding to only 100% of the amount that the department actually requested in the budget, while the defense industry howled that $842 billion was simply not enough. Now, some of my colleagues have already pledged that by the end of the year, they will pass a supplemental budget to give the Department of Defense more money and are currently drawing up plans for billions more in spending. If another huge supplemental is approved by Congress, the total could be the largest Pentagon budget since World War II. I support funding our military so that it can do its job to keep Americans safe. I support making sure that service members have the pay and benefits they deserve and the high-quality equipment they need to do their work safely. I support adequate resources for the whole Department of Defense to operate without cutting corners. I support ensuring that Ukraine has the support it needs from the United States to resist Russia's illegal war. But reports from Pentagon watchdogs and budget experts, both inside and outside government, have repeatedly shown that there are serious problems at the Department of Defense with wasting taxpayer dollars. Reports from the Government Accountability Office, the Department of Defense Inspector General, the Special Inspector General for Afghanistan Reconstruction, the Congressional Budget Office, the Cost Assessment and Program Evaluation Office, I've now run out of fingers, and the Pentagon's own auditors have all identified billions and billions and billions of dollars that do nothing more than line the pockets of giant defense contractors, often with little or no oversight from the Pentagon. When the Department of Defense comes to Congress to ask for more money, we should be asking why they aren't putting in place a few basic oversight tools to stop defense industry price gouging. Before DoD gets another dollar, they need to put checks in place to stop paying $1,500 for a medical device that can be purchased at Walmart for $192, and to stop paying $1,800 for vaccines that everyone else pays $125 for. Pentagon officials themselves estimate that savings just from tightening up our practices in hiring contractors, just that one area alone, would be about $44 billion over 10 years. Before we provide more money to the Pentagon, DoD needs to explain to the American people why it is failing to implement basic safeguards regularly employed by both families and businesses. This hearing will focus on a few of the key findings from budget experts. I appreciate their willingness to appear as witnesses. They have identified cost savings across the Pentagon's work, but because this is the Personnel Subcommittee, we're going to focus today on issues of waste related to how DoD buys personnel-related goods and services. I'll note, as a measure of how little congressional oversight there has been and how determined Senator Scott and I are to reel this back in, that this is only the second time in the last 15 years that the Inspector General has been invited to testify before this committee. Before turning to our witnesses, let me briefly highlight two key problems in this subcommittee's jurisdiction that clearly require congressional oversight. First, DoD fails to prevent price gouging by private defense contractors, period. There is no real dispute about this. One report after another from independent Inspector General has documented that DoD contracting officers agreed to pay excessive prices without asking companies for justifications, and that companies delayed or refused to provide cost data when requested. Without that pushback, the U.S. taxpayer is just a sitting duck for defense industry price gouging. By now, most people know that over-the-top price gouging occurs on spare parts and weapons systems. Earlier this year, I called out Boeing for its failure to provide basic cost data for almost 11,000 items. In other examples where that price data has been made public, we learned that Boeing charged the Army $71 for a pin that should have cost 4 cents. In another case, they charged nearly $1,700 for a ramp gate roller assembly that DoD could have purchased for $8. $1,700 for an $8 item. A recent investigation by 60 Minutes found that even after adjusting for inflation, we are paying 7 times more for each missile we send to Ukraine than we paid in the 1990s. But price gouging isn't limited to spare parts and weapons systems. It also happens when DoD is paying for health care. This week, I wrote a letter to the Defense Health Agency highlighting pricing on health care items. For example, DoD was paying $1,500 for breast pumps that Walmart sold for less than $200. The agency was paying over $1,800 for vaccines that could be purchased for $125. Multiply that price gouging by the high volume of purchasing in the military, and it is clear that taxpayers are getting seriously ripped off. Another way that taxpayers get gouged is through its contractor workforce. Our nation's defense is often supported through contractors who feed our troops, house our military families, transport needed equipment, and perform a wide range of tasks that in past years were either done by active duty military or by civilian employees. Over the past quarter century, DoD spending on service contracts has more than doubled, reaching over $205 billion in fiscal year 2022. This has created a huge industry of military contractors, turning them into billion-dollar businesses. But in many cases, hiring a contractor costs more than simply paying a federal employee to perform exactly the same function. At a minimum, DoD should be examining each contract to make certain the prices are reasonable and that the work cannot be done directly by federal employees for a whole lot less money. But that is not what's happening. Instead of carefully reviewing each government contract, the GAO has determined that DoD does not even know how many contractors it has and does not effectively analyze long-term costs. DoD has failed to safeguard taxpayer money, and it has opened the door to price gouging by government contractors. It is DoD's job to stop these ripoffs. As I noted earlier, this hearing will focus on cost savings in the jurisdiction of this subcommittee. We'll also primarily focus today on places where DoD can use authorities it already has. But let me be crystal clear. If the Pentagon wants more funding this year, above the 100% of their budget request that has already been fulfilled by Congress, then Congress should, at a minimum, give DoD more access to cost and pricing data from contractors, tie any increases in upfront payments to contractors to requirements that they deliver goods and services on time, remove a requirement in current law that military services must send Congress pricey wish lists for extra spending on top of their annual budget requests, require contractors to disclose changes in average prices and gross margins, and require any DoD component that fails to pass an audit to return 1% of its budget back to Treasury. For many of these proposals, bipartisan legislation already exists to make these changes. If other senators want to dump more money into the Department of Defense on top of fully funding the budget they already have, then they should also support including these common sense measures to fight back against price gouging.